Right, good morning ladies and gentlemen.
Good morning.
I'm going to take you on a little journey now. It starts this time last year. I'm going round hospitals. I need to get to the bottom of what's causing searing chest pain and shortage of stamina. The first hospital gave me painkillers. The second hospital put me on antibiotics, which were then repeated. I knew something more serious was up, so I pushed and said I need to see a consultant. I eventually got referred, and that meant a third hospital. He then took me for a biopsy. And at the beginning of August last year, I was given the news that I had a new tumour in my right lung. I had a sense of humour failure on hearing that, because in 2007, I'd been diagnosed with throat cancer. Throughout what is very gruelling treatment, I'd photographed and started to write a book about my experiences. It was 2 years later that Bangers and Mash was published. Within 3 weeks of that, I've been diagnosed again, this time with a tumour in my chest. This time, I was given a 10 to 40% chance of survival. I made a big decision then. I thought, I don't care how good an experienced you guys are, I'm not leaving my life in your hands with those odds. I'm going to go and put my own survival strategy in place. So I did. A few months later, I was all clear. Now take that introduction and move it forward to August last year. I'm going in to see my consultant for a prognosis meeting. Keith, we're not recommending chemotherapy. We can't do radiotherapy. It's too close to where you were radiated in 2010. It could prove fatal. We don't know at this stage if we can operate. If we can't operate, I'm sorry, there's nothing we can do. I'm sitting there listening to this and thinking, there's nothing you can do. There's a hell of a lot I can do starting right now. I left there and thought, what's the most important thing? Mindset. Get in touch with your NLP coach with whom you did such great work before. So I rang her up, explained the situation. She said 2 questions. 1, am I right in thinking that your first journey through cancer was when you became an author? And I said, yeah. And your second journey through cancer, was that when you started to speak? I said, yeah. Correct. Okay. We need a meeting. We need to look at what is the positive intent behind a third appearance. I put the phone down and just looked at it and thought, how do you do it? How do you always come up with exactly the right thing to say at exactly the right time? I'm now on my mission. I need to go and see the surgeon. I need some basic information. How long have I got if I do nothing? Maybe 18 months. How long will the lung last? 6 to 9 months. This conversation happened at the beginning of last September. So we run all the tests and he says, they're looking good. There's no obstruction for me to go in and surgically remove the tumour. However, it will involve removing most, or probably all, of your right lung. Excuse me, I'm rather attached to that if it's all the same for you. Besides which, this is very stable. Why can't we wait 3 months? See what I'm doing, see if that has an effect. And he goes, it's risky. I said, so is this. I'm happy to take that risk. And he goes, all right, have your few weeks. So I went off to do my own thing. It's a mixture of complementary medications and treatments and various stuff. One of which, acupuncture, I decided is going to be my project management tool for this exercise. So the 2 months goes by in double quick time. I go back and see him, run all the lung tests again. And he sit down for the meeting and he goes, there's been no deterioration in your lung functionality at all. I've seen the scan results. The tumour's increased slightly, but there's no other sign of activity. So what do you want to do? Well, you can put the operation back till next year for starters. Imagine my amazement when he said, okay. We sat down and had a chat. During that time, he said, I've got to tell you, in all my years of doing this, I have never ever come across a patient like you. So I said, thank you very much. I'll take that as a compliment. One other question. Can I travel? He looked at me as if to go, well, yes, I suppose so, but remember what you've got. Okay, so I'm out of there feeling very positive, go home. The reason for the last question is I'm sitting on an invitation I've had from a contact in the States. Would you like to come on a media trip to South Africa and Swaziland as the photographer? Now, my passion in life is travel with camera in hand. This is not going to stop me going on a trip like that. So I go. A couple of days into the trip, I get an email from the surgeon's PA. Keith, we want to book you in for your operation at the beginning of January. And I look at this and go, I don't think so. So I write back and go, I'm sorry, I'll be out of the country. Anyway, I'm not going to have an operation without another scan. Perhaps you can book that up for the middle of January. Okay. So off I go, the well-trodden route to the middle of London. I'm going to have something called the PET scan. Now what's involved is I go in, I get injected with radioactive glucose, and they lie me down on a dimly lit room for an hour before taking me for a scan. The scan lasts about 20-25 minutes, and the radioactive glucose will react with any live cancer cells it finds, thus giving them all the information they need. And then the bit that always amuses me, the warning. Remember, you're not allowed to go near pregnant women or very young kids for at least 7 hours. You're too radioactive. Wow. With that, I'm out on the street thinking, I must be glowing, like the kid in the Ready Break ads, if you remember them. And then the wait. Believe you me, waiting for cancer test results is nerve-wracking. It's 5 days till I can get to see my consultant. By the time I get to see him, my insides are like this. I know how high the stakes are. I walk into the room. I know this guy of old, we have a really good relationship. He's looking very relaxed and smiling. That's always good. His body language is a bit of a giveaway. So I relax a bit. He goes, Keith, your scan. The tumour hasn't grown at all. Yes. More importantly, there's been no other sign of activity whatsoever. Yes. So what are you recommending? He said, Keith, as a friend and a professional, go and have the operation while you still can. So, you know that's not going to happen. Something I'm doing is having an effect. It needs more time. So here's what we'll do. I'll go away for 3 months, come back, have another scan, and we can sit down and go through the results. How does that sound? Nice. You're incorrigible. Yeah, I'm not about to change. By the way, your talk is inspirational. I've sent him a copy of the longer version of this. Talking of inspirational, I met up with a lady 3 months ago that I was helping 3 years ago, and she said something at the end of our conversation which will live with me forever. Keith, without you and your book, I would never have survived my cancer. Reading your book was the single most important thing I have done in my life. Ladies and gentlemen, the power of the positive. Thank you.